Thank you. Welcome, everybody, for the last class of the winter school. I'd like to welcome Professor Volker Busch-Geertsema, who will be giving us a lot of insights on data. We all have differing problems and issues with data. We either complain that we don't have enough data, or we don't collect enough data, that we don't have resources to, or some of us also from the roof network have too much data, don't know how to use it or prioritize, etc. So I think today we will get a very good view on how to use data to understand situations, convince, to design also, and to adapt what we are doing. And so I would like to give the floor to Professor Volker Busch-Geertsema, and we will be able to discuss with all of you after his presentation. So.
Okay, thank you very much. Somebody probably opens my presentation, or do I have to open it again?
You can do it yourself, Volker, yes.
Okay, then here we are. Okay, you can see it?
Yes.
Okay, yeah, it's called the potential use of homelessness data for policies and practice. And sorry? Okay, I'm working for have been working for more than 30 years at an institute in Bremen, which is called Association for Innovative Social Research and Social Planning. I'm also the coordinator of the European Observatory on Homelessness, which is organized by FIANSA. And I have been part of a number of different European and international research projects. One which I am dwelling sometimes on is also the overarching evaluation of a program which is run by the Institute of Global Homelessness, and the program is a place for your own. It's a program with 13 so-called vanguard cities which try to eliminate or reduce street homelessness. And again, we are confronted with how to define the target, how to measure progress, etc. So that's what I'm doing. And now to my presentation for today. How do I go forward here? Can I move that on? That would be quite a moment. I seem to be not able to move that.
Have you tried clicking on the arrow down?
Wait, I will start it again. Okay. Go here, make it big. Okay, now that's the structure of my presentation. First question, why measuring homelessness? Should have a question mark. And how can administrative data be used for influencing policies and practice? Which data are relevant to be collected? What can data tell us about the effects of policy measures, and how can data influence the development of such measures? How to promote evidence-based policies, how to create an evidence-based service design, and how to set meaningful targets and evaluate progress towards them. That are the questions. First question, why measuring homelessness? It can serve very different tasks. It can be just be used as an indicator of social exclusion. We might want to measure the extent of urgent housing need of homeless people. We might want to measure trends over time, how it's developing. Is it getting more people or less people in experiencing homelessness? It might provide us data on which groups are most affected. Is it something where we see the proportion of women or of young people or of elder people rising? We might want to measure specific needs and specific problems which homeless people might have. We might want to have it for developing policies to alleviate or even reduce, prevent, end homelessness for certain subgroups or for all. We might want to measure the effectiveness of, and perhaps also the unintended effects of interventions. Or we might want, as we often see when census authorities try to include homeless people in their measurement, they just want to cover the complete population in population censuses, also those who are difficult to reach, and certainly homeless people are difficult to reach. And I have added a what else. There are probably many more reasons why you might want to measure homelessness. So my first question on how can administrative data be used for influencing policies and practice? Here I dwell on some studies, but we can come back to that, how that can be used on the local level as well. That's first of all, we can, of course, use administrative data to look at the changing profile of service users. We can just use the service data, and I already said sometimes service data show us that there are more young people, that suddenly the proportion of families increases or even decreases. We see more women. That's something which we found in Europe when we did our research on changing profile and the extent of homelessness. Some years ago, we saw that we had more young people, more women, and families were very differently presented in different countries. What is very influential, and where I want to go a little bit more into detail, is the analysis of a typology and the duration of shelter use. That was something which was extremely influential in the US. It was a study done by Dennis Culhane and by Randall Kuhn, and they looked at administrative data of shelters in Philadelphia and in New York. And they found that a very small minority of shelter users were the chronic homeless, and they occupied more than half of the shelter beds over a certain period. So we have, on the one hand, a very small group. On the other hand, they occupy the majority of bed spaces. And on the other hand, they showed that most shelter users are very short-term users, the so-called transitional homeless. They use shelters for only some days or up to some weeks, and then they used it once and then they were away. I mean, the whole study started with Dennis Culhane doing some voluntary work in one of these shelters, and he did that in summer, and in winter he came back and wanted to meet his friends he made there, and suddenly he recognized most of them were not anymore there. So he started to look at that data and was interested to see that really most of the shelter users are short-term users. And then there's again a small minority, about 10%, who use shelter several times in short episodes, the so-called episodic homeless. So that was very influential, the study, and I tell you more about why it was like that. And he also then studied together with Kuhn the administrative data, and found that the chronic homeless, this small group, That was also the group with the highest proportion of mental illness and substance abuse. Here you can see a little bit in a graph, a bit clearer. Oh, sorry, I haven't changed the last date. It's not 1st of October. It's 1st of October, but it's 1995. Again, but here you see the three periods. You see a very long period for the chronic homeless, and that this proportion, but the proportion of clients were only less than 10%, 9.8%, but they used 50.2% of bed spaces of client days. And then you see this very large proportion of transitional homeless people, only short-term homeless, almost 80%, and they used 32.5 client days, the proportion of beds. And then we have these episodic peoples, people who were on average only 18 or 19 days per episode in the shelter, and they made a little bit more than 10%. That's and that's has a lot of implications, and I will come to that again. And interesting is that was a study in 2 cities in the US, and my colleague Lars Benjaminsen did a very similar study of duration use in Denmark, and he could use administrative data for several years in Denmark, and he saw a very similar a picture on shelter use that was found in the US. So the prevalence of shelter use in proportion to the population was lower in Denmark than in the US, but the duration and the 3 types of shelter use were very similar, with one exception: what the characteristics of the transitional, the episodic, and the chronic homelessness concerned. In Denmark, there was a high proportion of people with mental illness and substance abuse in all 3 groups. So duration is obviously a very important indicator, and always, if you have only a point in time measurements, if you only look at one day, a spotlight, then you will find many more chronic homeless. Then you will find all these people who are only transitional homeless, because they are only homeless for a very short time. So if you look at one day, you will only see a small proportion. But if you look for a whole year or for 2 years, you will see that they are the great majority. So the long-term homeless people are those who are dominating the picture on one single day. The short-term homeless people will, in many situations, dominate the picture if you use longitudinal data and administrative data. This has important consequences for policies and services. Prevalence data, that means longitudinal data, the shelter use over longer time, they are, on the one hand, always higher than cross-sectional data. It's always more people being affected by homelessness if you look for a longer time. But on the other hand, potentially the picture is less dramatic. It's not all these people getting worse and worse and being at the end very chronic on the street, and you can't help them, and it's very difficult to help them. But there is more fluctuation if you look at a longer time, and you might increase the attention for transitions out of homelessness. You might see more people at least not using shelters anymore. This can facilitate the comparison between cities. We have here seen 2 studies which compared US and Denmark, but you can do it also let's say between Copenhagen and Aarhus, or between Thessaloniki and Athens, or whatever, or between Madrid and Barcelona. It has implications about the people affected. You will have different results if you look at the characteristics of the people. And of course, it has also different results about the average duration of homelessness or of shelter use in that case. So the result for the US was that a policy which is focusing on chronic homeless people, on those long-term people, may free large capacities of shelter beds, might reduce costs a lot, and it might be worth investing some more money to help these very chronic homeless people. And in the US, it was very clear different types of services are needed for these three different groups: the chronic homeless, the transitional homeless, and the episodic homeless. And different types of approaches we see to look at data, they provide very different information about the duration of shelter use and the composition of homeless people. In many studies, we see a large proportion of people with mental illness. If we look just point in time, just a spotlight, we might have a very different picture if we include all these people who are only for a short time transitionally homeless. Of course, we have to be cautious. Shelter use is not the same as homelessness. In the US, if you have used such a shelter, you might just be shocked away and sleep on the streets instead, or share with friends and relatives and still be homeless. Okay, this is just an example where administrative data were used and were very helpful even to change the policies, to change the focus of the policies, and also to be very influential on practices. It's also a type of study which also had some influence on the popularity, for example, of housing first services, just to mention that. Which data are relevant to be collected? Of course, what everybody does, or what most organizations do, they look at the age, they look at the sex, gender of people, they look on the household size and the composition, they look at migration background, etc., the socio-demographic data. But we can also look at various categories of homeless people. Most of you, or many of you, might be familiar with this European typology of homelessness, the ethos definition, where we have a distinction of people in shelters, in temporary accommodation, in the users of women's refuge, people who are victims of domestic violence. We might look at people who use advice services for homeless people who might not be in accommodation services. We might look at rough sleepers. We might look at hidden homeless people. So we might look on all these people together, as we find more this approach in the north of Europe, or we might only look at a very specific type of homeless people, like those using shelter or those using temporary accommodation. We might have, on the one hand, and I have mentioned that before, the point in time data, but also the prevalence data. Prevalence means people using over a certain times, using or being on the streets or being without a home. We might also look at retrospective data, which means we can ask people, have you ever been homeless in your life, or have you been homeless in the last year or the last 2 years? We had a recent contribution in the European Journal of Homelessness, where a German researcher looked at hosts of hidden homeless people He looked at he used the usual big surveys on population surveys on health or on use of or what people buy and so on, and he introduced some questions. Have you in the last 3 years given you a bed or a couch to somebody who had nowhere to go? So he found interesting indicators of hidden homeless people. You can use, of course, follow-up data, which are very interesting, which are a bit more difficult and expensive to collect. But if you want to know what happens with people after they have been rehoused, you want to know their housing retention rates, very usual indicators for the effectiveness of housing first services, for example. You might want to know if repeat homelessness occurs, if your service for prevention, for example, has been effective and people have been really sustainably protected from becoming homeless again, etc. So you need follow-up data for that. And then there are a number of very specific data collections. I have mentioned here 2, which are interesting. It's the chain database in London that's only for people sleeping rough. And so people, outreach services, outreach social workers have all the same database. And if they meet somebody on the street, they do only have to ask for very little indicators, and then they know more about the person because information is collected on these rough sleepers from different sites and in a shared database, which is of course raises a lot of questions about data protection, etc., but which also helps a lot helping rough sleepers off the street. I personally, and Tom Running, who is a member here of the city network, I was very interested in an exercise which the city of Odense did. They helped to track, they used tracking systems to track homeless people for a certain while, looked where are they moving, not only homeless people, also very marginalized people, where are they moving in the city over the day. And the idea was not to ban them from certain areas, but to look where services would best be placed and on what time of the day they might be mostly used. So that was a very interesting, and Tom might be interested to say more about that during after my presentation. Again, a caution is needed. Sometimes if we compare countries, or also if we compare situations in the countryside and in big cities, we have the service paradox, which means in cities where you have a lot of services and where you rely on data of services, you might find much more homeless people than in the countryside where you don't have these services and where more people might be hidden, or they might just move to the bigger city to find a service. So the service paradox is important when we compare data of different constituencies and different localities, and be aware that services can influence the number of homeless people without being really reliable on that the numbers are so different. Okay. What can data tell us about the effects of policy measures, and how can data influence the development of such measures? I have selected 2 examples, very simple examples about the quantitative development. One is the reduction of homelessness in Finland. The other is the decrease and increase of homeless people in North Rhine-Westphalia. And I think this kind of measurement is very easy, feasible for cities and for very different cities. It may cover different categories of homeless people, for example, only those in accommodation-based services, or other groups as well. For example, those sharings with friends and relatives and using homelessness advice services. In this case, it's not so relevant whether all homelessness categories are fully covered and if the total number is accurate, as far as the definitions and measurements are the same every year. It can be a valid instrument to inform about trends, however that is perfect or not. So you can have, for example, in North Rhine-Westphalia for a long time, the number only of people in municipal shelters were collected until 2009. And then people criticized that and said, but there are so many homeless people in the NGO sector, you have to include them. And then we had the task to change these statistics. And from 2011 onwards, you see that the number of homeless people were higher because it included the people using shelters of NGOs. But the interesting thing is also that we had a very important reduction of homeless people between 1995 and 2009. I always use that when I give training to people working with homeless people to show that obviously alcoholism and drug use has not reduced in that time, and mental illness has not gone down so much. So there must be other factors which influenced the numbers of homeless people so much decreasing, and suddenly after 2011 so drastically going up again. And these factors were demographic factors, housing, the factors of housing supply, immigration, and others. I won't go into detail to that, but it can show us a lot. And you can also do the same thing for a city or for a region or for other localities. This is probably known to some of you, the development of homeless people in Finland. Actually, most of these homeless people today are people sharing involuntarily with friends and relatives. It's a very small proportion only using still shelters. And you can see that in the year 1987, in Finland, they had decided to halve homelessness in a certain period. 1987 was the International Year of Homeless People, and they succeeded in reducing the number for quite a while. And then from 1995 onwards, it remained relatively, it increased a little bit, remained relatively stable. And people at the policy level said, we have to do something. We are a very rich, developed welfare state. We need to reduce the number of homeless people. How do we do that? And then they started to have certain strategies based on the housing first approach. And in 2018, they were, in these years, they also decided to concentrate on long-term homeless people and to eliminate homeless people, long-term homelessness. They reduced the number of long-term shelters. They recreated lots of new apartments with exclusive access for homeless people. And in 2018, they decided that they want to abolish homelessness altogether up to the year 2026. For many, Finland is an example of the good use of housing first. In the last years, Finland has turned also to use more prevention, and we will see if they succeed with this very ambitious target of eliminating homelessness. These are national data, and I know that you are, the main URBACT is a network of cities, but I think most of these statistics can also be produced on a local level. Okay, what can data tell us about the effects of policy measures? And oh, this went too fast. That's the same question. So, what can data tell us? Again, also, housing retention data may prove the effectiveness of rehousing approaches. You might want to know how many, if you have housed people, are they coming back? Repeat homelessness might be a very important indicator and proof of the sustainability of rehousing and prevention efforts. The prevention data may show us the need for early intervention for specific groups. We might suddenly have a larger proportion of this group or that group. We might see the currently, we might see the effects of the COVID pandemic and the economic crisis on the need to prevent homelessness. And we might also use data on the non-take-up of entitlements, of services, of certain types of accommodation to improve our service. And what we are doing at the moment in one of the German regional states, we want to know, we ask rough sleepers, why are you sleeping rough? Why do you not use accommodation-based services? And what can be done to improve the support that you don't need to sleep rough anymore. Okay, how to promote evidence-based policies. I'm quite quick. I should not run too quick. I can have a short break and ask for questions here and go on afterwards. I can't see the chat, can I? I think when I'm presenting, I can't. But have there questions popped up already?
Yes, Matisse has a comment and a question as well. Maybe he can also present it himself.
Yes, please.
Yeah, I had a question about the hidden homeless people. We have a lot of people that have not a stable home. For example, they change every month or every week. They go from friend to friend.
Yes.
In Holland, in Dutch, we name them sofa hoppers of banks.
Yes, yeah, coach server or sofa hoppers. Yeah.
So, do you have specific data about these groups?
Yeah, it's an interesting and very difficult to cover group. I mean, these what I talked about, the recent study on people who are hosts of such a population. This might be interesting if you ask in a normal household survey if anybody of these people has slept rough. You are confronted with the problem that many of these people will not be part of a household panel. But if you ask a household panel if they have given a bed to somebody who was homeless, you might get much bigger results. So in Germany, they have tried that first in Hamburg and then on the national scale. And they found that up to 5% of the population had given in recent years a bed to a person who would otherwise have had to sleep on the street or in shelters. So that's one way of trying to collect data on this group. Of course, hidden homelessness is hidden, and it's not easy to find the numbers. But what we are doing currently in Germany, we just got some weeks ago, we got the contract for it. In Germany, there will be a national homelessness statistics. They will be concentrated on beds, on occupied beds on a certain day. But the legislation for introducing that also introduced the duty for the national state to provide more information on people who are sleeping on the streets or who are hidden homeless. So what we are doing is that in Germany, and probably that's more valid for the north of Europe than for the south, we are very convinced that even hidden homeless people will use some services. They will use low threshold services. They will use food banks. They will use something where they can get cheap clothes, or they will also use a service where they can have a postal address, where they can get their post from the job center, because otherwise they wouldn't get their money. So what we are doing is to contact all these services and try to do a survey of people who are using these services and who are then filling in a questionnaire for us. This is an experiment to try to find them. I think, for example, in Denmark is done every second year, and in Finland, as I said, most of the people reported from municipality as homeless are those people who are sharing with friends and relatives and who don't have their home but are not accommodated in shelters. Okay, more questions?
Questions, no, but Matthias, you also commented on the cost benefits analysis about homeless people and the cost of shelters and care.
Yeah,
Maybe you want to mention that?
very difficult thing. We will come back to that in
right.
the course of the presentation. Okay, no more questions at the moment?
Not yet.
Okay, then how to promote evidence-based policies. Some days ago, I was in an international webinar with people from Canada and the US and Europe, and they were asking about how to use the evidence on housing first projects for also using it to influence policies. And one of the points mentioned there was that persons matter, of course. And if you look at the US, you have certain persons who were like Dennis Culhane, I mentioned him already, like people working at the administration, like Beth Shin and some more people there were very influential in influencing national policies on homelessness. And they are big sellers, but when you have that and the conference, we had them very often at our European research conferences. They are very good, charismatic sellers of their data. I think in Europe it's not so important that you have one or two very charismatic persons to push for policy change. Although I acknowledge that, for example, in Finland, the three wise men who did the homeless strategy for Finland to eliminate long-term homelessness, they have been influential. It was Juha Kakainen, for example, who was working at the ministry and then afterwards is now the director of the Y Foundation in Finland. And there's also a person, Peter Fredriksson, who was very influential at the policy level in different governments. But I think persons matter anyway. I mean, you need somebody and some persons who really use data to promote certain policies and change in policy. Awareness raising is, of course, important to make the public aware that it doesn't save a lot of money to keep people on the street, and it's not very cheap to have people always calling the ambulance or being in prison because they have no home to go to. Of course, the link with politicians and the media is important. I think good quality and robust data are needed for credibility of data analysis and the conclusions, recommendations. I often am quite nervous about research which is only used by lobby groups, which is developed by lobby groups, which is very small and which is very obviously developed to follow certain targets, political targets. And if that's very clearly to see, and you can't see that it's an independent and research work, then it might be not very influential. I think giving people with experience of homelessness a voice might also be very important to promote evidence-based policies. If they can they can use it, but it's not easy because sometimes there are only some persons trying to speak for all homeless people and is not representing the totality of homeless people. I would personally say, don't promise large savings. Argue for more efficient use of resources. The whole thing about Housing First in the US was very much promoted by promising big savings, and now we have in the last years we have a cutback or a reaction which says where's all this money which was to be saved by introducing this service? It's expensive, it doesn't save a lot of money, so it's a bad service or a bad change. I would always say it's better to use to say, here we have a pot of money, it's used for having a very undecent type of provision. It's used for administering homelessness instead of ending it. Use the money differently and you have much better results, and it's much more human, and it provides a long-term perspective for people, and it ends homelessness. So I wouldn't invest too much money or too much effort to show that you can achieve a lot of savings. And I would also warn to resist running for a steady increase of numbers. That's more for the NGOs than for the cities. The NGOs are always heading for large numbers to make the case for a very important problem to be solved. I think politicians are always, sorry, politicians are very often more driven into a situation where they say, oh, we can't solve this problem because it's very huge and we can't do anything about it. And if you insist of the feasibility of a solution, it might be more important. And if you have smaller numbers and can show that it's actually possible to sincerely reduce or even end homelessness, I think you are in a better position, and you will be heard much more by those people who might be important for doing policies which are evidence-based and which are in the interest of those people who are affected. Okay, next point. I found that not very easy to answer. I had the question in my when I did the outline, and then I thought, what the hell do I write here? So it was how to create an evidence-based service design. Okay, collect the evidence available on the support needs of different groups of homeless people, on the changing profile of those in need of support, on social work methods which are evidence-based, like critical time intervention, like assertive community treatment, like intensive case management, motivational interviewing, etc. These are all social work methods. Collect the evidence on evidence-based approaches, which are which we have a lot of robust data about Housing First, for example, about the effects of housing-led strategies, about the importance of prevention, etc. Of course, it's not always easy, especially if we talk about prevention. It's quite easy to show that something which didn't happen because you prevented it from happening is difficult to measure. You know, I mean, if you compare data in a city where prevention is good and in another city where prevention is very bad, that might be a way forward. But if you want to show that your prevention work does save a lot of money, it's not so easy because the thing which you prevented from occurring didn't occur. So it didn't create the costs, and that makes something a big problem for legitimizing prevention work and putting resources into prevention work instead of the shelters and the provision for people who are already homeless. And adjust your system. I think one of the very important points is the cooperation between different departments. I'm always surprised again when people speak about housing first, that they speak about the social work aspects, but they don't speak enough about the necessity for improving access to housing for homeless people. I think Finland did very well in that respect. Denmark didn't so well in that respect, but they had a good good mechanisms for housing people already. Also, the health sector might be very important, especially at the moment. We see how important cooperation with the health sector is if we speak about the consequences of COVID-19 on homelessness. And of course, central is to have resources to create an evidence-based service design. I think it's one thing which we learned in Germany is that it's very helpful to combine different tasks so that additional resources in one or two areas, like investing more in prevention and investing more in rehousing, may be compensated by saving in others, like less resources needed for shelters and for substandard temporary accommodation. Okay, do we have questions in between? Is there any comment? Is there anything?
Yes, maybe we can start with some of the comments.
Yeah.
Tom, I think you wanted to add something about how the savings aspect that Professor mentioned.
I completely agree with Volker that it's problematic to make housing first or the work with homelessness to a business case. But we just made a survey in Odense together with Lars Benjaminsen, in which we followed we have a little bit more than 500 persons, which we gave an apartment through Housing First. In Denmark, we have the possibility to follow the expenses. We have a personal number, so we can see what kind of expenses is connected to that person. Mm-hmm. And this shows that the over 500 persons which we gave an apartment, 80% of them kept their apartment, and they asked for fewer services. There was, if you make a total on prison, shelters, income, police, whatever, all that kind of stuff, there was a yearly lower expense for the state and the municipality for around 10,000 euros a head, and it's 500 persons.
Okay, Tom, and now I'm the advocate of the devil, and
You're welcome.
I am your person at the city responsible for spending money, and I tell you, if you have saved money or saved people don't use prison anymore. They don't use the ambulance. They don't go to hospital. Do you really reduce hospital beds? Do you really save money on your prison beds? It's not so easy. I mean, I totally agree on these calculations, but you will also get these advice.
Volker, it's a Nordic country, so therefore we have very big expenses, for example, on the shelter area.
Yeah.
And what's going to happen in the coming years is that we're going to do something like what they did in Finland, that we're going to reduce on the number of shelter beds, because there is some kind of no logic in working in getting rid of homelessness, putting them into houses, and then at the same time build a bigger and bigger area up in the shelters. So therefore, and that's the area where the biggest expenses, to be honest.
And there I agree completely. If you're able to reduce the provision which you are costing, then it's easy. But if you have, for example, a prison, you might have some empty prison cells, but you will not abolish the prison. You might, if you have to build a new prison, it might be not so big than expected.
But they ask for lower social support, for example. That's an area we would be.
Okay.
But I totally agree. It's not a business case, but at the same time, it has a certain influence that we can say to the national politicians and to the local politicians that there is also a bit. It's not a matter about spending more money. It's a matter about letting people have a decent life at the same time, lower the costs.
Yes, I think that's.
And we can say that we can document that. That's really that's heavy.
Yeah, and I also agree that things like humanity, like a decent life, etc., is also a very important argument. When I talked with the people in Canada about their point about this business case, Tim Aubrey told me if we introduce something to cure cancer, nobody is asking us for making a business case for it. It saves lives. But if we want to end homelessness and have such a much better provision for people in risk of homelessness, for mentally ill people, etc., we have to do this business case. Why do we have to do it? I mean, I know that this is a very powerful instrument to show that you might be able to save costs, but it's also sometimes a little bit dangerous. And if I look at those people in Budapest who had lived in the wood before, it saves not a lot of money to give them housing. It's more expensive, but it's also more humane. Okay, thank you. More interventions, more comments?
I think maybe since we're talking about ways to collect data and some examples, I think we could give the floor to Dominique maybe, how they're planning to analyze some of the data for hidden homelessness.
And Dominique is coming from?
Toulouse Métropole.
Okay, Dominique.
Dominique?
Oui. Yes, concerning data, we just find out, yes, concerning data, we have a waiting list. It is the same for all France. And in fact, when the people apply for social housing, they have to declare what is the situation right now.
Mm-hmm.
And one of all the list of situations that they can tick is I'm being sheltered by family or by friends. So we never analyze in details this. So this is part of our plan to go further in depth and analyzing this situation and understand it and to see why they wait so long.
Okay.
So sometimes data is available, but we don't use it.
Mm-hmm. Oh yes, very often, yes.
Okay, thank you, Dominique.
That's it.
So, Professor, maybe you want to go on, and at the end we can take some of the.
Okay, there are two more slides to be shown, and then you are free and should think about your questions and your comments.
All right.
Okay, how to set meaningful targets and evaluate progress towards them. This is also a bit influenced by my work, by evaluation work of these 13 vanguard cities supported by the Institute of Global Homelessness in Chicago. I think, first of all, it's very important to measuring outcome instead of output. It's not so interesting how many beds were occupied. It's much more interesting how many people have you rehoused successfully, and it's not so important how many social worker hours have been invested. It's more important what results did you achieve. I think if it's about targets, it's about setting realistic targets. Ending homelessness sounds very nice, but it's often a very long-term goal. As I have shown you for Finland that they've set this goal for, what is it, 2026 or something. Gradual reductions, a focus on specific groups, like for example, the long-term homeless is sometimes more realistic. Some of you might have heard about functional zero. Functional zero is quite a tricky concept. On the one hand, it sounds quite interesting and attractive. For example, if you want to end unemployment, you would never say that nobody will be unemployed, never in the city or in the state. But the idea is that if somebody becomes unemployed, he or she will be very quickly re-employed, and the time being unemployed will be very short. and it will not happen again. So the idea of keeping homelessness as low as possible, as short as possible, and not to be repeated would be a good target. Sometimes functional zero is yet, especially in the US, also used for cities where you think they claim that they have ended homelessness, and you see people still sleeping on the street because their functional zero is we are providing more free beds than people counted, or they're very tricky concepts of functional zero, which are not very which are not very helpful to be honest to follow. And of course, you need an adequate baseline. I was quite surprised that sometimes people set targets, specific targets, that they want to end or reduce homelessness by 50% for people over 50, but they don't have a baseline to count people over 50 who are homeless. So you will never be able to measure progress in that sense. Does your baseline really measure what is at stake? Is it reliable? Does it cover the complete picture? Like, for example, do you only collect data about those who are sleeping rough and use specific support which is provided, but not all the others who don't use the support? And does it cover the fluctuation, or does it only look at a by name list where at a certain point of time and you see how many did you rehouse from this list, but you don't look at all the other people being on the street after the list has been collected. So that's something which sometimes you can find in cities which claim to have reduced homelessness and do a bad job in showing, in really evaluating the progress. And of course, you need recurrent and continuous measurement to evaluate progress. It's not so easy. It seems to be easy. We have seen these numbers from Finland, and from some cities we have great data to show progress, but in others the numbers and the measurement is not very reliable. So I try to sum up. That has been written in the morning today, so my apologies that it's not complete, but I think data can be a very powerful tool to influence policies and practice. Often data collection and measurement at the local level is much easier than at regional or national level. So you don't have to agree very complicated on definitions. You might have not so big problems with data protection, etc. And so on the local level, I think it's sometimes much easier. Trends data may be helpful, even if they are not perfect, if they don't cover all the different groups, and if women in domestic, women who are victims of domestic violence are not included, but they should be included. But that's not so important if you have if you want to measure a trend. Different methods and different kind of data may lead to radically different conclusions. I tried to make that clear by the duration and the typology of shelter use. Data alone, of course, they don't change anything. Transfer into policies and politics is a separate task. It has to be thought about. So we have a lot of not evidence-based policies, and it's a big effort to make politicians and people responsible for the practice really aware of existing evidence. And setting realistic goals and measuring progress is, of course, important. As a last sentence, political will is, of course, always essential. If politicians don't care about your data, you will not succeed. Thank you very much. Okay. That's so far my presentation.
Thank you very, very much. This was very, very interesting. And I also see from the messages that participants also agree. Very clear and helpful. I'll go on to the questions, and I will try to combine a question from Patricia and Angela, Patricia from Ghent and Angela from Timișoara. So, which relates to data which is collected at the European level and also national census level, because a lot of us, because we lack resources, I'm talking from Greece, we lack local resources to collect data locally that you say is a lot more advantageous and easier at times, but we rely a lot on regional data, national data, and data collected at European level. So the two questions are that what could Europe do with regards to data and data collection that would benefit cities specifically? Yes. And the second is, how could, let's say, cities and the local level influence or use the national census? And do you think it's possible to include data on homelessness in the national census? And do you think that would be useful?
Okay, who's Europe? A simple question. Who's Europe? I mean, there are very different players at European level. Of course, many of you know FEANZA and our organization, the European Observatory on Homelessness, which is run by FEANZA and financed by almost exclusively by the European Commission. So what we have done, and after discussing years and years about what are we talking about? What is our subject? Are we talking about the same group? Is this a very simple ethos definition, which I think is very influential, has been very influential, not in terms of that everybody is accepting all these categories, but in enabling us to communicate with each other, to know what we are speaking about, to know if in the national number or the local number in one city, in one country, is comparable with the number in another country. I mentioned Finland. If we would only look at shelter use in Finland, it would be very tiny number. And if we would look, if we would compare the number of sharing with friends and relatives in a southern country, it would be a much bigger number. But in many southern countries, and that's okay. I mean, that's a cultural thing as well, that, for example, in Spain or in Greece, if you are sharing with your parents or with a relative, it's not seen as homelessness at all. It's seen as something which is the responsibility of the relatives to provide shelter for their relatives if they run out of money or if they are evicted of their house because they can't pay the mortgage. So the important thing on the European level is to make clear what we are speaking about. And I think ethos and ethos light are very good grids on enabling to communicate with each other what we speak about. We have tried to bring Eurostat to move Eurostat to collecting data, at least for this retrospective question, to ask, have you in the last years or ever in your life been in the following situation, sleeping on the street, using a temporary accommodation, etc. Obviously, that has been tried, but we are not given the results. It has only been tried by some national statistical offices. And obviously, it's very difficult because we have quite low numbers in EU Silk. They used EU Silk, and that's a small household survey where it takes a long time till you are in the survey, and it's not very perfect. So it's not so easy. I mean, I think one thing which can be done by the European Commission is to ask national authorities and also cities to provide data. That's easy, but when it comes to compare the data, it will be very difficult. And I personally, I'm not a big fan of this. At the moment, it's 700,000 homeless people in Europe. There's a number in the field. I don't know where it comes from. It doesn't come from our observatory. And I actually have read a lot of different definitions what that covers. Does it cover people sleeping rough in one night, or does it cover all homeless people, or what does it cover? I mean, we are still, unfortunately, we are still quite away from having a European number, but we can compare trends, for example. It's much easier if we look at trends, and we can compare specific groups. We can compare the shelters provided, but then we have this shelter paradox. If we see a country where we have little shelter space, that doesn't mean automatically that there is little homelessness. So it might also just inform about the provision. The national censuses, when we did years ago, when we did this project where we tried to harmonize ethos with the census definitions, we have tried a lot. Bill Edgar at that time was the coordinator of the European Observatory. I was part of the team, and we tried very hard to influence the statistical authorities at Eurostat level and also at the national level to collect better data on the national census. But one of the big problems is census is it every 10 years, or is a large period in between until you get a new census. The last census in 2011, the second last, that was numbers on homeless people were collected, but then they were merged with all the other people living in institutions, in homes for the elderly, in prisons, in different types of collective places where people were difficult to reach. So we didn't succeed to produce numbers on homelessness only in very few countries we had that. And sometimes they were completely misleading. What we had as a number from the UK for homeless people was ridiculous, actually. And when we saw the first evaluation or the first results of census, they published something on homelessness, and it was ridiculous for most countries. It was not valid and not helpful. And we thought, we discussed, should we try next time to influence census authorities to provide a better picture, and actually gave up, because we thought the sense of a census is to cover the whole population, but the sense of a census is not in the first place to isolate these small groups and to provide a very validate picture on these small groups. So we have given up on that. Sorry.
Okay, I think there is a comment by Matthias, which is quite good. It's important to involve also departments of housing, security, because it's not only about service provision or social service provision or sheltering while measuring the whole situation, because it's also a housing issue.
I completely agree.
Something we did also in Thessaloniki. We focused on the housing market, for instance, in terms of creating a baseline.
Yes, I very much agree that that's important for collecting data, but of course it's also very important on providing solutions for homelessness, of course. And as I said, if you look at different national strategies concerning homelessness, it's very few strategies like the one in Finland, where they have from the beginning thought that access to housing is very essential, apart from housing support, but access to housing is very important. And they have in the last 8 years created, last 8 years, they have created 5,000 additional dwellings reserved for homeless people, for long-term homeless people, and for rehousing homeless people. So that's essential, and a national strategy which only looks at social work and the social department will fail. It will fail. Okay.
Another comment from Dominique is a question, basically. Is it because the process is very complicated that there's no systematic data collection? Or is it because the authorities prefer not to know because they will have to do something about it? And she comments that it seems that COVID has made it inevitable to look at the problem. currently?
Yes, I think that there are some researchers, very prominent theoretical researchers, who tell us that not counting homeless people is by political will, that you don't count people because you then you don't have to do anything about it. If you don't know the numbers, you will not do anything about it. I'm not sure, because we have an increasing number of governments who are counting homeless people, but of course we still have this problem that in most nations we will not have an official national number. Actually, usually the national government said it's too complicated, it's very complex, data protection and so on. And I personally have fought at least 20 years in Germany for getting national statistics. I will get it. We'll get it next year. So, and it will not be perfect. It will cover only a part of them, and it will be, unfortunately, it will be point in time. But it has taken a long time to get that. But it's not impossible, and the housing crisis had helped to collect these data. And yes, with COVID, we have also a new problem, which makes it obviously that we need more data on this group as well.
A couple more questions coming in. So Najib is asking us from Ghent, what is the best resource that we can tap into to get reliable data on homelessness and problems related to homelessness in Belgium and in the EU? Where would you look at to get reliable data?
The best resource. As far as I know, that in Belgium there's quite a lot of things going on to get a better quantitative picture. My colleague Koen Hermans is very much involved in that, and he's actually the chair of a European network which is called Measurement of Homelessness in Europe, and I'm the vice chair of the same, and it has just ended its work. And I know that he's very busy on surveys, and of course the easiest is always to collect data on shelter beds, but it's also very imperfect and very restricted to, and it has this problem of the service paradox. In the countryside, you might have much less provision for homeless people, but you can't be sure that it does also mean that there are less homeless people. I'm not so. There might be other people to be better in a position to say what the best resources are. I can't say more on that. Yeah.
Okay. So it's something, the next question is from Gordon, and it's something I think you have been working on and you have written about actually in the past. And articles, academic articles as well, which relates to the methodological problem. If part of the problem is the lack of a universally agreed definition of homelessness, which creates then methodological problems as well.
Yes, on the one hand, yes. On the other hand, actually, I'm quite surprised that something which was developed by a few researchers and some FIANZA members like Ethos and Ethos Light is so influential all over not only Europe, but abroad as well. I mean, it was taken up by Australia in revising their definition of homelessness. It was taken up by New Zealand from the statistical authorities there. Our contract with the German government is exactly to find, to test the feasibility of data collection on all groups of Ethos Light. So it's, yes, there's not an agreed definition of homelessness across Europe. You can't dictate that. You can only propose a way how you could find a consensus. The consensus will probably never be on all groups. I mean, I mentioned the example of victims of domestic violence. It's highly controversial. Women running shelters for homeless women, for victims of domestic violence would say many of these are not homeless. They have a home to go to, but they have a violent partner who keeps them away. There are all these problems, but I think we have made quite substantive progress in at least having a common understanding what we are talking about, and that's quite a lot.
Yeah, that's
Some more
true.
questions?
I think something that will also help us as the ROOF network and our advocacy work, the question by Stephen, is there, what kind of work is being done at the European level to improve the comparability of data, and by whom is that, and what exactly is happening? It could be non-governmental, but it could also be European institutions level. It's also important for us because since we also focus on data and data collection, it's important also for us to know which processes to influence and how to approach that. So this would be
at least I know that there is a current there's a tender going on by the European Commission on providing a toolkit for fighting homelessness and to conduct a number of round tables in all European countries to promote a common understanding of homelessness and also to discuss appropriate measures to reduce it. So that's the usual thing what the European Union does if it's not originally responsible. They improve knowledge exchange. They will have these peer reviews. They will have this discussion rounds, etc. But they are still not in a position where they would be able to dictate a comparable data set. That we are still far away from that. But there is, I think there is work on trying to increase the common understanding. Okay.
One thing that Liat shared just in the chat with us, an article which is about our roof cities and about the COVID-19 crisis and data collection, and how in some of the cities, this article also shows how counting has been improved or facilitated, let's say, throughout this process. So whoever is interested can also go to that link and read the article. It is very interesting. And Gregor from Liège has a question for you. Shouldn't reporting on housing inclusion data be a priority?
Yes, it might be a good idea on the national level. Again, the European Commission is not in a position to prescribe that, but they do this EU SILT business. They do that on a European-wide level, but in terms of other types of data collection, they are much more kind of reluctant to provide their own European definition. And I think it would still be very difficult to find a complete consensus on all groups. I would personally more tend to use this typology, and okay, we could collect some numbers on some categories of this typology, but it will be very difficult to impose using the whole typology.
I have a question.
Please.
Yes. So when looking at hidden homelessness, of course, it will always depend on the context, on the country, what data is available, etc. But let's say, speaking from Greece and Thessaloniki, trying to look at and understanding hidden homelessness, what kind of like proxy data could we use? Because we don't have, counts and this kind of research done at the local level, which can reveal a lot of information. Do you have any interesting examples of proxy data that are being used that reveal hidden homelessness? It could be, I don't know, like being detached from the power utilities, for instance, like in a home, or such examples that one could use, which is available. It's low cost, because for us it's also important to feed the data with low cost accessibility to data resources.
Yeah, pretty difficult. I know that, for example, what you just mentioned is used for, in Germany it's used for example, the electricity meters. They are used for more for showing the vacancy rate, to show which apartments are obviously not used because there's no electricity used there. The other thing of hidden homelessness, I think, to use existing data for that, pretty difficult. I must admit that I don't really have the easy solution for that. I still think in service-rich societies, it's the best way is to look at the low threshold provisions, which will inform you much more about, on the one hand, about people sleeping on the street, but also people being illegal or not very clearly, not having entitlement for social support, for money support. That's one group, but the hidden homeless are another group, and they might also use these services, but you're also asking for a very cheap or cost a method.
Preferably.
low cost, and actually I don't have the solution. Does anybody else have a solution for that?
Does anybody? Yes. Anybody has experience in using proxy data? No.
I just want to intervene because I think the problem is that on the political level or on the scientific level, it's very often that you don't have a consensus, because there are all the time discussions about what is a good definition and what is a good methodological approach.
Yeah.
The problem for the local authorities and actors is that the problem is there and they have to find solution. So I think we have to be pragmatic and to focus data on the most important things for us, and that are the data on housing first. I think it's my position.
Yeah, when we did our measuring homelessness in Europe report, we also were saying that the least controversial group are the people sleeping rough. That's the least controversial group. But then asking about data on people sleeping rough, it's in many cities there's no data on that group. There's data on people being in shelters. But people sleeping rough, which is nobody would doubt that people sleeping rough are homeless people, but data on these people are very often not available, and in some countries they are therefore not available because it's a very small, tiny proportion of all the homeless people. People in Finland would say, or in Denmark, or even in Germany would say, the group who is not, or in the UK, the group who is not sleeping rough is about at least 10 times bigger, or even much more times bigger than those sleeping rough. But on the other hand, there the definition would not be controversial. But data on people sleeping rough are only available in a number of cities in the south. There is almost nowhere a national number on people sleeping rough, and there was for a time in the UK, but then it ended and they had gone back to estimates, so even the consensus on on which group to measure will be not easy.
Yes. Gregor, you
Okay.
want to add something? Okay. Your microphone's off, Gregor.
Oui, I understand it's difficult for me. We have to try to have a consensus on a slide, and then we can see how we can help in the different countries and regions to create the methodological conditions to create new tools. I think the situations are very different in the different countries, and it's a question of political priority.
Oh yes, of course. Yes.
What is for us the most important? And it's a big question, and I think we have to put the housing question more in the front of the political agenda in Europe.
I completely agree.
Because for the moment, the social policy is focused on territorial issues or on employment policy and work policy, and not enough on health and housing issues. But it's my political view.
And of course, homelessness is also not only a matter of urgency and of sleeping bags and of just a roof. I was a bit surprised that your network is called a roof. I would always prepare something like a home, but never mind. Roof is very practical too, and everybody understands that this is about homelessness. So it's not a critique, but it's I think more than a roof is needed to end homelessness. If that is a good ending remark, that should be it.
Yes, I think it's a perfect ending remark. And also your remark in your presentation that there needs to be political will, as also repeated by other colleagues. So just last call, if anybody wants to comment or make a question. Anybody? No? So Professor Geertsema, thank you so much. It was a great pleasure to moderate in this session. Extremely interesting and personally very important for me as well, data collection and a big concern. So many insights, I think, for all of us at different levels. So thank you once again. And I pass the floor to Patricia. And thank you to all participants and interpreters again, from me as well.